Okay. Hello, friends. This is Dr. Safavi, the Denver dentist from Claremont Dental. Welcome to another series of Tooth Talk Thursday, and also supporting our local businesses. So today I'm honored to have Ms. Ann Brooks with us from Soulstice, Innovators of Peri-Operative Therapy. Welcome, Ann. Thank you so much for being with us today.
Thank you so much for having me. I really appreciate the opportunity to talk about Soulstice and help some of your clients along the way.
Thank you so much. I'm so excited. Yes, I had no idea until I met Ann what Peri-Operative Therapy is, and I didn't even realize there is such a discipline. And so when I heard about it, I thought so many people can benefit from this service. So I am so excited, first of all, that you offer, this service. And also I would love for us to get to know more about this service and how we can use it. So I just want to make sure I prompt the listeners that please stay with us till the end. And has a big surprise for us. So make sure you tune in and stay with us till the end of our interview. So Ann, can you tell us a little bit about what Peri-Operative Therapy is and how did you, because you are the innovator of this kind of therapy, so if you can tell us how, with your background, how you came about developing this and with the need, and so tell us a little bit about this therapy.
Sure. First of all, Peri-Operative Therapy. So peri means around. That would be around an operation or surgery. That's how we named it, because we wanted to have people understand that we can work with you before a surgery, that we could help you maybe put off an imminent surgery if you're trying to schedule something around your activities or your daily life and you still want some rehab beforehand. But most of the work is after the surgery. And the way this was developed, it was about 17 years ago. My business partner, Kent Lindbergh, and I met each other, and I was working with reconstructive cancer patients with plastic surgeons, and he was working with elective therapy, like liposuction, tummy tucks, facelifts, that sort of thing, also plastic surgeons. So we found each other and we were like, wait a minute, we're doing the same thing. We can come together, develop this, teach other therapists how to do it, and really meet a need for rehabilitation after elective and reconstructive surgeries that just isn't out there. It wasn't then, and it hardly is now. A lot of people have reconstructive for orthopedic surgeries. They go to physical therapy, for example, but there really wasn't anything that addressed the need in the phases of healing for these types of surgeries. So we did this, like I said, 17 years ago, and we hit the ground running and never looked back. We hired therapists, and we actually formed our education, which was called the Fundamentals of Peri-Operative Therapy. We got it approved by our National Certification Board for continued education. Because we were not taught this in school, we were actually taught to stay away from surgical sites. And that didn't make much sense either, just because of the evolution of healthcare. And even after a knee surgery, people are moving. After a hip surgery, people are moving. Babies aren't swaddled and put in incubators. They're put on their parents' chest and, immediately getting that skin-to-skin contact. So we felt like, why aren't all surgeries like that? And we found out quickly that there was really a need. And our plastic surgeons that we were already dealing with felt the benefit. And then we just kept teaching our employed therapists how to do this work, feeling comfortable working in the acute phase, swelling immediately after surgery, using manual techniques to address that pain level, reduce swelling, and then ultimately, once people are healed, working in the scar tissue, softening that scar tissue, creating longer fascial lines, better range of motion, and the postural distortion that comes along with being in pain or post-surgically. So that's how we came together and developed it. And over the years, it's grown into something that many surgeons and other healthcare providers in the Denver metro area have come to rely on for their rehab for their patients.
That's so amazing. That's so wonderful that you have been able to partner with these surgeons, because as we know, everybody's so different, and healing process, can be so different for everybody. And with you tailoring that, meeting the patient, before, and then meeting them later and meeting them at their needs, that is incredible. And you can have the most successful surgery, but if you don't have the right care to help you with the healing, that's such an amazing service that you provide. So,
and yeah, I was just going to say, it was something that was sort of like pushing a ball up the hill too, because the surgeons that we deal with were not used to having a rehab option or a resource, and really didn't know what we could do to help their patients. And what we found out, and they found out quickly, is that we get to be another set of eyes and ears on the case. We take them by the hand from the surgeon, who did an amazing job, did exactly what they were intending to do, and then help them through that healing journey with some resources that they maybe didn't even know they needed at that moment or moving forward. So the pre-op appointment sort of helps with that. Like, have you thought about somebody maybe watching your dog or babysitting your kids, or who's going to drive you to your appointments? I mean, I'm sure our doctors ask them that, but sometimes we're the fourth time they've heard it, and it's like, oh, I guess I really do need that. So even those kind of resources that don't seem very massage related, because this is a technique built on massage techniques: manual lymphatic drainage to facilitate the lymph system, scar work, which is fascial work. You've heard it as myofascial work. That's the kind of things that we're doing to address what's going on in those different, either subacute, well, starting with the acute phase, sometimes days after the surgery, into the subacute. And I want to make clear that we follow our surgeons' instructions on the post-surgical side. We honor the way they do things. You can have 5 surgeons do the same surgery, and they will have 5 different post-op instructions. We have actually accumulated post-op instructions and put them in files, so we know what the surgeon wants us to do. And then again, they've come to trust that we're going to follow their guidelines as well. And that's very important. You can't have people telling you doing multiple and different things. We all have to be on the same page to be a team.
that is so wonderful. That is so important. I mean, you just pointed out such important, points. One, that you will be another, eyes and ears for that patient, so they feel cared for, and you're partnering with their surgeon, so they're not getting different messages, and the surgeon can be confident that that their instructions is being reiterated. And that's so important when you have such a team. And I think we're just learning every day that it really takes a team to take care of someone and be successful. And I love what you said, that sometimes I think it takes, when we get injured, that's when we realize, oh gosh, we took so many things for granted. And I think, until we get injured. And that is such a good point, because you have done this before, and then you're like, have you thought about this? Have you thought about that? And just help them. And you are such a resourceful person, as I know you. So you have a lot of resources. If they haven't thought of someone or haven't thought of something, you can connect them to be connected, to have those help and resources in place.
Yeah, it's true. And I wanted to tell you another trend we're seeing, especially this year, probably started last year. More and more people are getting surgery outside of the state of Colorado. So they're going to Florida, they're going to California, they're going to Chicago, wherever, because there's so many specialists out there, and they're all getting very well known for specific surgeries. However, these people come back home and they don't have anybody. So they are looking around like, who can help me? Who does this? There are surgeons who include this type of service directly after their surgery, and they have them stay, for example, in the state that they had the surgery. Then they come back and they're like, okay, how do I have this done? And fortunately, they're directed to our website because of the specialty, that we have. But I would love for more people to know that this is a resource. It's okay to ask for the resource. If I can help them, I will. If I know of a better resource for them, then I will send them that way too. It's not about us. It's about our clients, whatever they need. If they need another type of specialty, then I'm going to send them that way too. That's what it's all about.
That's amazing. And it's so important to get the word out. As you said, the need is there. I think it's just important for people to know more about it. And then, so I was so excited when you told me about it, because I'm like, when I now know if a patient of mine is going to surgery, or if I know a friend or family member that is going to surgery, I'm like, you need to go see Anne because you need to know if you have everything in place, if you can benefit from this service, in your kind of surgery before, and I'm sure anybody can. So it's so important for us to get the word out. So that's why I was so excited when you agreed to come on and talk about this service, because I think it's just brilliant what you have been able to create and open the door for more provide. And actually, this is really good for any provider that might be interested in getting this training. So more therapists can get trained and provide this kind of a service.
Yeah, it's true. In fact, I talk to, I'll have people ask me, well, do you know anybody in Arizona? Because I live there, can you help me with that? And I've looked up and found therapists. They're not peri-operative therapists because they would have gone through my training to do that. Mm-hmm. But I can talk to therapists that are equally skilled, and maybe they just haven't seen this type of work yet, but we can talk the same language and talk through it, have a phone call or a Zoom call just to explain the situation. And I'm perfectly willing to do that. In fact, we used to provide the education, that continued education, but as our company downsized last year, it's just become impossible for us to teach this sort of thing. But I absolutely love talking to my peers anywhere and guiding them through that process, because, if you live in Arizona and you can't find somebody, then we need to help you get to somebody.
Exactly. And hopefully we'll get you training. we'll get you back on being able to, because I can tell you're a natural teacher and you're so generous with your information. So I think that will be a perfect partnership and training so people can learn more about it. So, Anne, thank you so much for coming in today and talking to us about this wonderful therapy and the resources that are available for people who are going to go through surgery. So everybody is ready, drum roll. So Anne, tell us, first of all, if you have any questions, please put your questions in the chat. We'll be happy to answer any questions you have. And also, if I will be putting Anne's information and contact information, email and website, everything that you can directly contact her, and she is wonderful with getting back with you for the information. But for now, I would like us to hear what Anne has to say for the surprise that she has for us, and we're ready.
Absolutely. Well, first, Dr. Safavi, I would just want to thank you. I appreciate this opportunity to talk with you. I respect you in every way, professionally and personally, and I'm honored to be interviewed and, given this great chance to talk to people with you. So what I'd like to do, I think the best thing that people can do is take advantage of this free 30-minute virtual conversation. We can do a consultation. We can talk about if you have a loved one or a friend that might need these services, if you personally need these services. That is a great way to start, because then we can design how we'd move forward. So a free 30-minute virtual
Oh,
consultation.
thank you so much. That's so generous. I appreciate it. And I know so many people are going to appreciate this and benefit from this. So thank you. Thank you so much. And I'm so grateful that you were able to spend this time with us. And so thank you, everyone, our listeners, also for being here today, and look for all the information in the chat. And thank you again. Have a wonderful day and keep smiling. Thank you.